My last myth, myth 5, state-run healthcare systems, such as exist in Canada and Europe, are better and cheaper than what we have here in America. People who make this claim usually note that life expectancy is higher in Canada and Europe than it is in America. Now, I would say the key thing is not life expectancy that we should be focusing on, but it's about outcomes from diseases. Life expectancy is influenced by a number of variables, such as the quality of a country's healthcare system, diet, genetics, exercise, smoking, pollution, low-income groups, marital status, and, of course, infant mortality rates. I mean, in America, we allow little infants to live much longer, but if they die, they're counted as infant mortality. In other countries, they don't make the effort to allow these fetuses to live, and so they count them as they didn't come into being. So we have a number of issues with life expectancy that we need to focus on. A study published last year in the British medical journal Lancet Oncology, which is very famous, suggests in their study that America is better at treating cancer than any of the 16 countries in Europe or in Canada. They found that Americans have a better survival rate after 5 years than 13 of the 16 countries, 13 of the 16 most prominent cancers. An American man has nearly a 20% better chance of surviving for 5 years after being diagnosed with prostate cancer than his European or Canadian counterpart. These are very important points. So I just want to spend a few minutes talking about the Canadian system because that's the system that I grew up under. We can control, you always hear in the media, the United States is spending 16% of its GDP on healthcare. Canada spends 9%. We're totally inefficient. It's too expensive. So how does this actually work? Anyone can determine and say, we're going to spend 9% of our GDP on healthcare too. But what does it mean when government sets that global budget? They have to control cost. In Canada today, they can spend 9% of GDP on healthcare, long waiting lists for care, ration care, and a lack of technological equipment. The average Canadian in 2007 waited 18.3 weeks, that's over 4 months, from seeing a primary care doctor to getting treatment by a specialist. A lot of docs, stop practicing medicine in November because their global budget for treating the type of diseases that they're specialized in to treat are not, the budget is used up. The average, in Canada, they rank 13th out of 22 Organization for Economic Cooperation and Development countries in MRI machines per 1,000, and 17th out of 21 in CT scanners. Canada has only 2 positron emission tomography machines, and when the people who specialized in positron emission tomography, radiology, and oncology, when they were trying to be credentialed for their specialty, the head of the Royal College of Physicians and Surgeons said, we cannot approve or credential any of these docs because they've never been trained on the equipment where they are getting their specialty. They were told they had to go to Duke or Harvard to get training before they could be certified. But of course, then they don't have the machines in order to be trained on. As Sarah mentioned, in Michael Moore, in his movie, he took a clip from myself being on the O'Reilly factor, where when O'Reilly said, what do you think of the Canadian healthcare system? And I said, I don't like it for the 3 main reasons: long waiting lists, ration care, and lack of equipment. Michael Moore didn't include my answer, but he said, I don't like it. And then he used that to introduce all these wonderful Canadians who love the Canadian healthcare system. Well, of course, I don't think that Michael Moore knew that I was actually Canadian, and I knew about the Canadian system. And most of these people are probably people who have never had to use the Canadian healthcare system. If you don't need to use it, it's not a problem. He went on to say that the UK, France, and Cuba are such tremendous examples of systems where healthcare is actually free. Well, as we all know, nothing is free from the government. It's all paid for by us. And Canadians pay dearly for their health insurance. They're paying on average $5,000 a year. And what do? They have to wait, and they can't get access to the latest equipment. So, you know, these are all myths that we have to tell Americans what a single-payer, government-run system will mean for our health. The new Prime Minister of Italy, Sir Silvio Berlusconi, when he was diagnosed in Italy with a heart problem and was told he needed a pacemaker, if Michael Moore said, you know, England, France, Rome, Paris, all these places are so great, why did he come to the Cleveland Clinic here in America to have his pacemaker installed? Because we have the best, and people come from Canada and all over the world to pay for health care they can't get in their own country. Canada has a very small population, 32 million people, fewer people than here in the state of California. But there are 3.2 million Canadians. 10% of the population is waiting to get a primary care doctor. Now, docs are not going into primary care medicine. You hear that all the time in the U.S., there aren't enough primary care docs. Well, because the controls, the amount of money that you can make as a primary care doc and the ability to practice the kind of medicine that you want to practice is just not in it. So docs, even in Canada, say we're not going to become primary care docs. It's not worth it. And a lot of them, of course, have emigrated to the United States to practice not just for the money, but to practice the kind of medicine that they were trained to practice. There were, you probably read in the paper, last fall, there was a couple in Calgary, Alberta. The woman was expecting quadruplets. That would be my worst nightmare. But she, when she went to go to the hospital in Calgary, which is, you know, about Canada's 4th largest city, there wasn't a single hospital bed or a neonatal unit to deliver these quadruplets. So they were airlifted to Great Falls, Montana, a city of 55,000, where her quadruplets were successfully delivered and all survived in a healthy way. When you hear people in America say there are too many hospitals, too many doctors, too many people, you know, having access to the best care, we have access to the best care, and people in Canada don't. There was, when I was home in Vancouver about 4 years ago on Memorial Day, the front page of the Vancouver Sun, a young couple expecting twins. They couldn't get a bed in the city of 3 million people, and they were airlifted to Edmonton, Alberta. That would be like flying from here to Denver. And the government paid for that. But the interesting thing is the twins were delivered. When they came home, the husband said to the mainstream media in Vancouver, the Canadian healthcare system is that of a third world country. My last story is Belinda Stronach, former Conservative MP from a very wealthy family. Her father, Frank Stronach, owns a company called Magna, big automotive parts company. She switched from the Conservative Party to the Liberal Party and ran for the leadership. Last June, she was diagnosed with breast cancer in Ottawa, Ontario. Now, she had always said, I do not believe in a two-tier healthcare system. We don't want private payers in Canada running alongside the government system. It's terrible. But when she was diagnosed with breast cancer, where did she go? America. She came to the UCLA Medical Center and had her breast cancer surgery and paid for it herself. You know, people in Canada do that. So one of the most exciting things in Canada, and I think it's ironic, in June 2005, the Canadian Supreme Court, now it's not known to be a conservative court, ruled that the ban on private health care and private insurance in Canada is illegal because Canadians, under our charter, are entitled to life, liberty, and the security of the individual. Chief Justice Beverly McLaughlin said, access to a waiting list is not access to health care. And Madam Justice Marie Deschamps said, the idea of a single-payer system without waiting lists is an oxymoron. So what we say in Canada is, Canada has the very best healthcare system that the 1970s can provide, because that's when the government took over our healthcare system.